Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office, where I'm joined with Chairman Mark Kern, and today we have the Director of the St. Clair County Health Department, Barb Holt, with us. Before we get started, I want to send out a happy birthday to Sam.
Yes, it's Sam's birthday today, and she well deserved to be relieved of her duties this afternoon.
Happy birthday, Sam.
Happy birthday, Sam. Thank you. For today's report, again in St. Clair County, we had 632 people more tested, and for a total of 29,741 folks that have been tested in St. Clair County. We have 87 new positive cases today, for a total of 3,357 positive cases in St. Clair County. We're glad to report we have no new deaths to report today. We are still reviewing some discrepancies in what the state is listing as deaths in our county, as well as what we're recording. So we're going to follow up with that, and we'll have more for you next week on that. Statewide, they had an increase of 1,532 positive cases across the state of Illinois, and an increase, unfortunately, of 19 deaths in the state of Illinois. Again, we work diligently every day, and we as a community need to work together to try to control the spread of this virus, and the worst case scenario, we don't want people to die from this. So again, Team St. Clair, we need to get together and make sure we follow the 3 W's. As far as COVID-related patients in the St. Clair County hospitals, we have 46, and fortunately at this time we have no patients on ventilators. So again, that's some good news. For congregate settings, we have 1 extra case today for a total of 18 cases at Caritas Family Solutions in Belleville, and 2 extra cases for a total of 77 at Cedar Ridge in Lebanon, Illinois. All the rest of the congregate care settings that we've been reporting have stayed the same. Every day, the chairman and Herb and I and Sam and all the rest of the guests that we have on this news briefing talk about ways that we as a community can help control the spread of this disease. And it's not just St. Clair County having the same problems of folks not following the 3 W's, not wearing your mask, not social distancing, or making sure you're washing your hands. We're hearing the same thing across the state of Illinois. In Adams County, they had a large outbreak from a large social event, or several counties are reporting folks traveling on vacation to hotspots. Even if they go with their own family members, going out of state into these hotspots, the family members may stay in the same house or the same condo, but they come back and they're positive for COVID. We had a family of 13, and 8 of those 13 came back positive for COVID. So again, even you around your family members or your neighbors, please remember to wear your masks. Other events, especially the younger people, we're seeing a lot more cases in the younger people, those less than 29 years of age, across the state as well as St. Clair County, and especially people visiting bars and attending those larger social events. 4th of July parties, we're still seeing the remnants of that, and just numerous examples of people not social distancing. So when you go someplace, when you go to work, when you go to the grocery store, make sure you look around. Are people social distancing? Put yourself in a good position. Wear your mask. Make sure you wash your hands and use your sanitizing agents when you come out of a store, the grocery store, or wherever, and ensure that we practice those things as a community to really try to help tackle this disease. It takes us all. One other thing I would like to add, that next week we have testing clinics all over the county, 7 days in a row. And those are, and I know we have them posted on the Facebook page, mobile testing next week will be done by Illinois Department of Public Health. And each of these will be held 8 to 4 every day. On Monday, we'll be in Millstadt at Liederkranz Park. On Tuesday, we will be in Caseyville at Caseyville City Park by the Wilson Pavilion. On Wednesday, we'll be back in Muscuda at Chevy Park in the Great Big Ag Building. On Thursday, we'll be in New Athens along the front, the Kaskaskia River at their New Athens Oak Valley Park. On Friday, we'll be back in Lebanon at the Prescriptions Plus hardware store. We'll be there from 8 to 4. And then Saturday and Sunday, both days for the weekend, we will be at the Belleville East lower level parking lot. This is the one along West Boulevard, West Boulevard. The lower level parking lot where it's all brand new asphalt. We will be there each day from 8 to 4. So if you can, please come out, get tested, get your family tested. And again, please, every day, everywhere you go, practice the 3 W's of wash your hands, wear your mask, and make sure you have that social distancing of 6 foot apart. So with that, I will turn it over to Chairman Kern. How you doing, sir?
I'm doing great, Barb. So let's just talk a little bit about, with 87 new positives today, your job's gotten bigger, tracing and tracking of people who have COVID. How's that going?
It's a task, and our staff is working very diligently, very hard, concentrating on contacting those cases to make sure they understand that they're isolated and getting information on their contacts so we can try to control the spread of disease. We have hired new contact tracers that are helping us with that. We have staff working overtime and the weekends just to keep up. And it's a big challenge, but that's what public health's about.
And all that information is private. So if they call you and ask you these questions, when you find out that they were next to John Doe within 6 feet, not wearing a mask, when John Doe gets that call, he's not told that he was given the name of the person who was close to him.
Right.
He's just being told someone was close to you with COVID.
Absolutely. We follow all HIPAA, which is the medical privacy laws, the confidentiality laws. So we'll talk to the case, the person that was positive, and get those contacts. We reiterate to that individual that is the case, we will not reveal their name, irregardless if John Doe is adamant, oh, I know I got it from Barb Holt. The interviewer does not reveal any of those names to the contacts that then need to be quarantined.
So you do have some people who must give a false number or refuse to answer questions, but that's really minimal?
It is relatively minimal. Those folks, again, we try. If not, we send them letters to say, please contact the health department ASAP. It's as good as the information they give us when they go to the clinic. Obviously, they're concerned about their health because they went to get tested, that it's important enough for them to know what their test results are. So we do everything we can to follow up with that individual. Unfortunately, sometimes it's a day or 2 or 3 later, but we're very, very extensive in following up with those folks.
And it's all about trying to control the spread.
Absolutely. And again, just if I may, isolation is for those folks that are tested positive, and meaning they need to stay home 10 days to let the virus die out of their system, and as long as they're not symptomatic and they don't have fever anymore. Anyone that they may have come in contact with are the folks that will be quarantined. And we get a lot of questions about, well, I was in contact with someone else that was quarantined. Only those folks that have touched base or touched the individual that's positive should be quarantined. It's like the game It or Tag. If you tag the person that's it, the positive person, then you are quarantined. If you tag another person that's quarantined, they're not required to be quarantined. So it's very important, and that's how we control it, because we know these people have the potential of being carrying the virus. If we pull them out of the community, then the virus is out of the community from being spread. And typically it takes 14 days for it to develop within your system.
And the purpose of the mask is?
The purpose of the mask is the way the disease is transmitted is through respiratory particles. So I'm sure, and you've probably seen or go on YouTube, and they can show you the picture of someone sneezing and how far it can sneeze out and how far those droplets can go. If you wear a mask, you control those droplets. You control those airborne droplets because it's a respiratory illness. You have to take it in, breathe it in orally. So wearing a mask is the best protection you can from spreading those droplets.
And when both parties are wearing the mask, that's the best protection.
Absolutely. When I'm wearing a mask, I'm protecting you. When you're wearing a mask, you're protecting me. that's how it works. So yes, as a community, we all need to wear a mask.
All together. Team St. Clair.
Team St. Clair, sir, absolutely.
Chairman, real quick.
Thank you. Yes, sir.
When we get a positive, Amanda sent a little note in and said, FYI, Jackie Joyner Kersey was an awesome testing experience. Less than 5-minute wait from the minute we pulled in. Super sweet lady, did a fantastic job with my 5-year-old. So, the testing sites, that's what we want to
Very
hear.
good.
We want people to get tested, and so that's a good experience. So anytime you can get to those sites like that, that's what we want.
Absolutely. For the testing sites next week, they will be using the nasal pharyngeno, which will be through your nose, that the nurse will do the test on the individual, and we can take anyone 6 months of age and up. We can test.
Good information.
Okay, thank you.
Thank you, Barb. So we'll go into the zip code report right now. Remember, these are new positives in the zip code, and then we have cumulative numbers that started way back when in March. So in 62059, we go up by 1 again today to 10. 62201 goes up by 3 to 168. 62203 goes up by 7 to 130. 62204 goes up by 1 to 99. 62205 goes up by 5 today to 130. 62206 goes up by 4 to 297. 62207 goes up by 9 to 188. 62208 goes up by 6 to 202. 62220, we're going up 4 today to 267. 62221 went up by 8 to 290. 62223 went up by 8 to 138. 62225 went up by 1 to 13. 62226 went up by 2 to 336. 62232 stays the same at 69. 62239 goes up by 4 to 31. 62240 went up by 2 today to 11. 62243 remains the same at 20. 62254 went up by 3 to 111. 62255 stays the same at 9. 62257 stays the same at 19. And 62258 is also static at 42. 62260 went up by 2 to 34. 62264 went up by 1 to 64. 62269 went up by 5 to 208. And 62285 went up by 1 to 28. So all this week we have had guests on the show, other than Monday when we had our good friend Mike McManus from Memorial Hospital. We've been talking about schools the whole rest of the week, and today we are lucky enough to be joined by the Assistant Superintendent of the Wolf Branch School, Dr. Sanderson.
Hi.
Hi, how are you?
Excited to be here.
Excited to be here and excited to get back to the school year.
Our reality, our new norm. That's
When
right.
when does your new norm start?
So our new norm with teachers will start August 17th. We have 2 days prior to the kids coming in, and that'll be the 17th and 18th, and then students will start in on the 19th.
So that's about 3 weeks, a little
Give or
more
take.
away. So tell us, what's the school board's met?
Yes, yes,
And-
we have another meeting Tuesday night. So just the gist kind of our plan. Much like the District 201s as well as 189s, where we're following, we created our plan based off of the CDC guidelines as well as ISB, Illinois Department of Public Health, with St. Clair County as well. But making sure that we're following those protocols, setting up sanitation things, and all the likes, keeping the social distancing. Early on in June, we sent out a parent survey just to ask, like, from March to June, how did it go? And then what happens if? Like, what are your thoughts? What do you need? What do you foresee being the challenges? So the admin team, as well as our committee, we have a transition, kind of a remote learning committee. And we met throughout the summer and started really looking at those challenges. One thing for I think as a result of that survey, at that time, roughly 43% of our parents said they would more than likely consider remote learning. So we knew that there's a lot of challenges. They were worried about obviously the safety of their children, but then a lot of uncertainty. We knew that we're pretty well balanced, where we still had some kids that have to come to school, and whether we're a public service, and we needed to figure out a way to make sure that we had that opportunity for kids to also come to school as well as remote. So in our plan, it's a two-pronged plan, much like the others. We will offer, parents have already started in on our questionnaire. We're offering remote, 100% remote, and we're also offering in-person learning. So in-person will be 5 days a week, Monday through Friday. And a little difference with ours, we're a pre-K through 8 district. Our kiddos will come from 8 to 12:30 every day. But then from 12:30 to 3, we're offering some adult supervision during that time. And that's a little different than some of the plans that I've read. The remote will happen every day, and those details are still being finalized. But teachers from 12:30 to 3 o'clock, really 1:15 after lunches, but they will have then the time to really work with our remote learning kiddos. As well as anyone who maybe happen to be in person and struggling with one of the concepts or needing some extra attention. They're not off limits for those kids. Those kids will be able to remote in as well in the afternoon and work with teachers.
So how does that work? So in the morning, K through 8 will, if they want, will come to school. They sign up at the beginning. Do you have to pick one or the other?
Yes, we're asking families to pick one or the other and to commit for a quarter, only because we're trying to minimize the in and out for teacher sanity as well, and making sure that the contact tracing, different tracing, it's easier for that to happen. So we are asking people to commit to at least a quarter. That's not to say if they start in person, that if a health condition changes, then we go remote. But we're asking that we at least, and for transportation purposes, that we get at least a good quarter out of it.
So then the students that show up, do kindergartners wear masks?
Well, right now that's the guideline, and that's what we will enforce. So we've ordered some clear plastic masks, because we're dealing with a different beast. With the young kids, kindergartners, it's their first time in a school experience, and that's scary in itself. And so we're trying to keep all of that in mind, that as the babies come into us, also making sure, because the hugs and the high fives and things like that are off limits right now, but also trying to create that friendly environment, that inviting environment, where kids remember those years, and that's when they start really developing their love for school. So we do have those measures in place. We right now, parents they're sending in their surveys, whether they're going to do remote or in person, and then from our results, we will start really looking at how to balance those classes and how to get the social distancing in, and then what happens with the young kids, if we need to put more people in place, and where that needs to happen.
So some districts are using Google Learning.
Yes.
So will
Google
you
for
have
Education.
will you be delivering a live product to the kids that are home?
Yes, so right now we're in conversations with, can we live stream? And there's so many moving parts to that answer, because we have to make sure bandwidth that's capable as well. So our technology department, Stephanie Melvin, she's done a really good job with just reaching out to other districts to see how they're doing it as well. But what we're hoping to do is following a schedule, like a condensed schedule. So instead of the 8 to 3, we would follow a 8 to 12:30 schedule, and they will get all content areas, core content, as well as like our PE, our specials, and our encores. I think it's roughly like a 33 minute class, and then kids who are remote at home could have the option to remote in during that period, or they could it'll be recorded, and they can because I think for a lot of parents, it's also the flexibility of having the remote. So if they need to maybe come in and watch a recording later in the afternoon, it's there for them too. It's not off limits though for the in-person kiddos. If they maybe sat through class and they just didn't get it, or they need to see that again, that recording will be offered for our in-person learners too.
So what's a special and what's an encore?
So specials and encores, those are basically like the ancillary classes. Like we have debate class, we have a finance class for our 8th grade, guitars, we offer a STEM class, public speaking, your art, your music, those type of fun classes.
So speaking of music and is band, are those still contemplated? Sports?
Yes. So band and chorus is really important in our school, and we feel that it's just been, I think it's been the common theme with all of us that we have to try to keep those pieces together as much as possible. Now, Mrs. Partney and Mrs. Tessero, they do a great job. They've done a great job through March with really working on some Zoom as well with remote kiddos. But what we're hoping to do, there's some guidelines that the conductor has to be like 10 feet from the front line. Some plexiglass will go in place and things like that. So we are hoping to put those those safety precautions in place to just continue that as much as possible.
What about technology? Will all the students have access to the same technology, or are they going to use what's at home? You'll supply if they don't have?
Absolutely. Prior to this, we've been a one-to-one district, which means every kiddo has one device, and we use Chromebooks. Some districts use iPads, but we have Chromebooks for K-8, and then we do have some mini iPads for our preschool setting. But absolutely, they will have their individual device, and so for K1 right now, they will be on carts. Now, if something happens and we have to go remote 100%, then we will work with the families to get those devices in their hands. Grades 2 through 8, they will carry to and from school. We realize that's not ideal. We usually start that at 4th grade, but predicting that maybe at some point we have to go remote, we would like the families to really start learning those platforms early on. And because our 2nd, 3rd graders are going to be learning that from the beginning of the year, we think that that's important that parents are learning that along with them when we're starting to do our routines and get kiddos situated on our learning programs.
Because this might be the new routine.
It might be the new norm, unfortunately. And that was probably one of the most difficult pieces last March when we were thrown into the situation. I think our teachers did a fantastic job with it. And even though we've had technology, there were pieces of that technology we hadn't really explored yet. Videoing ourselves and being kind of in the homes of everyone face to face.
You're doing a good job,
yeah,
by the way.
But that's something that it's tough. It's tough to do. And so without hesitation, our teachers jumped at it. But part of it we noticed parents kind of struggled. Like the kids knew how to get on and access, but parents wanted more. They were used to maybe a workbook coming home or papers coming home. And because we weren't doing that, because of the situation, they needed a little bit more from us. And so that's one thing that I think early on, having us roll those devices out early on and teachers and parents working together on how to do this or that, I think that'll be helpful.
And so then just to go back to the afternoon, so you finish with your classes and then the teachers are available from noon to 12:30.
Yeah, they'll be available roughly. So in an elementary setting, there's a different beast with once we release at 12:30, not everyone's picked up right at 12:30. So sometimes our primary teachers, they sit out with the students and they wait for moms and dads or grandmas, grandpas to get in line to come. So roughly, I think by the time those teachers get out, it'll probably be about, and they have their lunch hour, it'll probably be about 1:15 that time frame will start, where they're accessible then to the remote learners kids who have been in person that maybe have follow-up or questions, and also to parents if parents need guidance.
All online.
All online then.
What about the meals? Will you be delivering to the home
So
settings?
we are doing, we're doing more of a grab and go with our cafeteria. So kids that purchase, if they're a bus rider, they'll go by the cafeteria and grab before they get on the bus. If they're a car rider, before they head out. So we have this all kind of built into the system, to our schedule. They'll go through cafeteria, designated area, grab their lunches and head out. And then the kiddos that are going to stay for that 12:30 to 3 o'clock time frame, we will, once we get the bus riders and car riders out, we will open kind of that area up for them to be able to eat as well. If parents choose to send in a bag lunch for those kiddos that need to stay for that time period, they can do that as well.
And all this subject to change according to the positivity rates and what
Absolutely.
happens.
You know, we rely on our experts, and if they feel that, hey, right now we're safe to do something like this, a hybrid of some sort, we feel that even for the mental, the mental state as well as the physical, we need to be in school, like as much, and we need to try to provide that service with all those guidelines in place. Once they deem that it's not appropriate or that we're at risk, absolutely, then we go to plan B or C.
And you're much more, you've had much more time to prepare than last March.
We have. Right now we're living kind of in between these three worlds of in-person, 100% remote, or kind of in-person and remote. And it can be a little taxing, but nothing what you guys are facing every day.
You have, it's a lot taxing for you. Herb, you look taxed.
I'm aggravated.
What are you aggravated with?
No, I appreciate that information.
Absolutely.
I consider teachers, administrators, the custodians, the cafeteria workers, they're going on the front lines now. And you've been there, and this is a new world for all of them, and I applaud each and every one of them. And when I see comments on our page like, they ought to be ashamed of themselves putting the children and teachers in that position. Well, you people who are out there following us, come on, have some compassion. These teachers, these administrators didn't ask for this pandemic. You just heard this lady say that, in March they got thrown into a whole new world. They are doing their best, and I assure you, with the assistance of our health department, Barb Holt, you just heard her talk about how important it is. The health department is working daily with all of these school districts. You heard it yesterday from the superintendent who was here, the day before from Belleville East superintendent. They're not putting the children, they're not going to put those children in any danger. They're taking every precaution that they can. So please show some compassion for these people, just as you do as our first responders.
And these kids have to get on with their lives.
Yes, they're our future.
If they have a grade, they've got a schedule. So it's K 1, 2, 3, 4, 5, 6, 7, 8, freshman, sophomore, junior, senior, and then, and if one of those stages is interrupted or it doesn't happen, the system doesn't work. And so you're just trying to keep everyone.
Keep the wheels moving.
That's it.
Well,
And
Chairman, and I think back to the graduations that we just, the kids that went through school, that's what you go to school for, and then all of a sudden, I can't walk across the aisle, I can't, so it's difficult for everybody, and we don't want to have that next year.
Absolutely.
Right.
And we realized this plan isn't for everybody, which is why we wanted to really give a remote option as well. That there are families that are dealing with different crises that we can't help, but what we can do is try to take a part of that stress and offer some remote if possible. We didn't want to do the you're here or you're not type
Yeah,
thing.
you're giving them the option.
Absolutely.
So it's
And
not
so
like
if-
you're saying, no, this is our plan, you're going to take it or leave it. You're giving them that option, and I think it's great. Brian, you had a few other questions?
Yeah, there are actually several questions relating to the clear masks that you talked about.
Yes.
Definitely something very interesting, a lot of concern. Would those be masks that still fit the same safety guidelines as the other masks that are issued to the students, or are they more like a face shield type?
No, not a face shield. Early on, we did buy some face shields, and then it was deemed that those weren't as appropriate. So, no, these masks are actually masks, just like the cloth masks, and they have a window in them, really for like our speech and language kiddos, our kids that might be on the spectrum that that are struggling with that anyway. Our younger our teachers that are teaching younger age students, our pre-K kindergarten that need to read lips or they need to see a smile. So no, those will not be. We will definitely make sure they fit the guidelines. But yeah, that's who we're really targeting for those masks.
Okay, thank you.
So Belleville East is going to be light blue. Belleville West is maroon. Is leopard pattern? Is that what
No.
you're
So I have a good friend that made this for me, but I
Okay.
also have a blues one because we are a blues fan, a family. But yeah, if I could get Mr. Harris to agree to this,
There
that
you
would
go.
be way
That would
fun.
be
How about
something.
that, Scott?
We really appreciate you being here, and we know this is
Absolutely.
stressful, and there's a lot to do, and so
I can assure
you got
you.
3 weeks. Don't be nervous.
We'll give you our best. That's for
You
sure.
always do. Thank you.
Thank you.
Thank you very much. We appreciate that information, and I'm sure our followers do. And, you know, Chairman, it seems like we're preaching to the choir, to our Team St. Clair. But I got to tell you, the Team St. Clair members are spreading the word, and we're seeing more and more people understanding what's going on with this fight that we've got of this invisible enemy. We had today conference calls with the director of IEMA, and the deputy director went well. As we said yesterday, they're sending in Representative in to meet with us next week about our numbers. So we're excited about that, to get whatever help or guidance from them. I wanted to give a shout out to the mayor of Fairview Heights. He posted a nice letter today, basically just saying, hey, we're all in this together. And they sent it out to their business operators, so we really appreciated that. Got an email from the mayor of Fairmont City. He actually had a meeting with their business people today and their police chief and fire chief, and kind of just going over what we've been talking about. We're all in this together. We don't want to go backwards. We want to stay where we are. So I appreciate the mayors who at least listened to our conference call the other day, and everybody that's getting on board. Next week we'll have all week, thanks to Susan. She's got us 5 more school districts to come on. So we're trying to get the whole county covered to answer the parents and grandparents' questions. We get a lot of them. We got people calling the EOC about schools, and we telling them, well, we're going to get your district in here, and you'll hear it from them directly. So yeah, 135 days, and we continue to go. It's probably going to be another 135 days. I shouldn't say that. I hope not. Sam hopes not. Barb hopes not. The staff hopes not. And everybody watching this ought to hope not. We ought to wear a mask, wash our hands, watch our social distancing. Those 3 W's is what we all need to be doing. And, I still got my candy somewhere around here. Nobody's ate a piece of it yet. So, I don't care if it's 2%, 1%. We want everybody to be safe. We want everybody to have a good weekend. We're going to be back here momentarily with Cindy and Daisy to translate this into our Spanish community. And yes, we will be back here tomorrow, Saturday at 3:30 for our next briefing. Everybody have a good evening.